is an easy one.
Okay. Sir, I'll start with the A. A
So
is,
it was labeled A to F. So this is
yes,
easy.
sir. Yes, sir. A is the uh
No one
al
in the chat box, please let Dr. Varun only answer. Yes.
sir,
You can start with E, whatever, A to F, whatever. If you want to start with F, you want to
sir,
start with
B is the annular ligament.
excellent.
Uh, A is the ulnar part of lateral collateral is the radial part of lateral collateral ligament, and C is the um, ulnar part of lateral collateral ligament.
So ulnar part. What is the name? How do you, what do you write?
Um,
Exact name. I wrote the exact name. In this, if you don't write the exact name, you are not getting your marks. Is a half a mark for all the six. So that makes it 3 marks. So annular ligament, you get half marks. What is C?
Sir, C is the um,
Okay, B, A. A
sir,
is almost.
A is the radial part of the lateral collateral ligament.
So the better name is radial collateral ligament. Okay.
Yes. Okay, sir.
And this you are almost there, but this is the most, C is the most important one. You should
The
remember.
lateral ulnar collateral ligament.
Excellent. LUCL.
Yes,
Lateral
sir.
ulnar collateral ligament. All these coming from the lateral epicondyle. This is going on to the ulna right here. This is going on to the proximal part of the radius, actually merging with your annular ligament. I've taken out this part. What is this part? Any
So
idea?
that's the accessory
Excellent. Accessory
ligament. Uh,
accessory collateral ligament.
collateral.
So these are the
And
four parts of your radial
of the
collateral ligaments or the lateral collateral ligament. Okay.
so on the medial side is the medial collateral ligament, which is formed by D is the anterior band, E is the transverse band, and F is the posterior band.
Hmm. So you got four right. E and F you mixed.
Okay, sir. F
So
is the transverse band,
F
and
is the transverse band. So from the medial collateral, from the medial epicondyle, you have some one thing going anterior, one thing going posterior. So this
yes,
is your
sir.
anterior band, this is your posterior band, and this is going transversely. This is the
Right.
transverse. Okay.
Yes,
अब नहीं हुआ कभी है ना?
yes, sir.
Okay. So these are this should be आपको कोई if somebody wakes you up from your sleep, you should be able to mark this. This is very simple, very easy, but this is very important because because when you are treating a patient with instability, you need to know what you are working on and what is important, what is not that important. Okay. Okay. Dr. Varun, you there?
Yes, sir. Yes, sir. Yes, sir.
So next part. So treatment plan for the X-ray shown in the attached picture. So first would be you have to make a diagnosis and then you make a treatment plan, and treatment plan includes what do you plan to do and how do you plan to do. Okay. So what's the diagnosis here?
So the terrible triad.
Terrible triad of the elbow. Excellent. So what is the triad of the terrible triad? Three parts.
Sir, posterior dislocation of the elbow, a coronoid fracture, and radial head fracture.
Excellent. So how do you plan to treat it?
Sir, I would like to get a seat after doing the ATLS protocol and ruling out any neurovascular injury. I would like to get a CT scan first, and
So for
after
this
getting.
again, I'll just stop you here. So remember, you have 5 minutes for a station. Okay, for whatever you're telling me, you have to finish that in 5 minutes.
Okay, sir. Sir, I would like to go for a.
Yeah, you can write all that, but we'll have your exam. The person who's checking your people will have uh, keywords in his answer sheet, which on the basis of which he'll mark you. So you can write all this, but OSCE is being precise, short, crisp, precise, and just talking about what is asked actually. Okay, it's not like a Viva because Viva they can go on for as long as they like. this you'll the slide will go away in 5 minutes, and you
Yes.
will not be allowed to answer for that station after 5 minutes. They'll take away your answer sheet. There are 20 sheets given to you. This sheets of station 4 will be taken away. So okay, ATLS protocol, and then said, what do you want to do? A CT scan.
Yes, sir. A CT scan, and then I would, sir, like to go for open reduction internal fixation for the radial head and coronoid, and along with that I would like to assess the instability, and if there is any instability persists after that, I would like to do a ligament reconstruction, and even after that, if any instability persists, then we could do a spanning elbow X-fix, and I would also like to keep a radial head prosthesis for backup if the radial head is not repairable.
Okay, okay. So I'll go by one. We'll just write it down what all you said. ATSL protocol, patient is stable. We get a CT scan done, assess everything. Then we do open reduction, or if open reduction. Okay. And what all you want to do in open reduction fixation, you said you want to one fix your coronoid fracture fixation. Hana? You said that?
Yeah, yes, sir. Coronoid
You said that
radial
you
head.
want to do a radial head. So you want to do first which? कैसे करोगे
Sir, I
आप?
would first do the, I would, with a lateral approach, I would first see the radial head,
Mhm.
and see if it is fixable or if it is unrepairable. Also, sir, if possible, if the coronoid can be fixed through the lateral approach, I would do it. But if not, then I would have to take another approach for the coronoid.
So for that from lateral approach you have to do, you'll have to first fix the coronoid. Otherwise, if you fix the
Other,
radial, you'll not be able to see the
yes, sir. Yes, sir.
coronoid fixation, radial head, or if oblique replacement. And then you said you will like to assess the ligament here. Which
Yes,
ligaments?
sir.
Both? One?
Both of them, sir.
Both of them, you mean medial and lateral side both.
Yes,
So
sir.
what do
But
you expect? What do you expect would be there?
the lateral LCL injury will be, sir.
Hmm. So for a terrible triad, you have to do this one, this you have to do two, and you always have to do your LCL. It's a acute injury. Why do you want to do a reconstruction? You'll just do a repair. Usually it
Yes, sir.
just involves the whole, it's normally your whole LCL along with your common extensor origin is just avulsed from your lateral epicondyle, and you just get it back, attach it there using anything, anchors, sutures, whatever you want to do. So you do not need to do a reconstruction with that graft or something. You just do a repair over there. Okay.
Yes, yes, sir.
So it is this order what we are looking at: coronoid, fracture fixation, radial head or if oblique replacement. You mentioned that, and LCL repair. After this, you assess whether medial side is also required or not. If required, it is unstable, then medial side repair. Then assess if it's not stable, then X fix. Okay,
Yes,
that
sir.
should be the approach.
Yes, sir.
So approach, you have to write yes, lateral approach or lateral plus medial approach. So you have to mention which approaches for the lateral. Lateral, you can use a Cockcurts, or and medial, which approach? What do you use?
Hotchkiss.
Hotchkiss, you can use. Easier is to use a FCU split approach. You can use that is very easy. You just look at the nerves, go through the two heads, between the two heads, and your coronoid is right there.
Mm.
Okay.
Yes, sir.
So we got all this radial collateral, annular, lateral ulnar collateral, and anterior band, posterior band, transverse band, coronoid, radial head,
Sir,
reconstruction.
should we also mention how we are fixing the radial head with mini plate or with radial head plate or with screws
डू यू
or
हैव आपके पास 5 मिनट है बेटा. ये देख लो
okay.
क्या क्या लिख सकते हो. जितना मैंने लिखा है ये तो लिख पाओगे आप 5 मिनट्स में, है ना.
Yes,
उसके
sir.
you want to mention ATLS. This is what I'm showing you. This is our answer key. Rest of the material would not get you any more points. This is 3 marks and this is 2 marks. What do you, How do you think 2 marks the your examiner or your person who's checking would allot marks? So I know this is 4.5 marks each. That makes 3. For me, this is 1.5 marks, and half marks is approach. ATLS doesn't even come here. Your plates doesn't even come here. I don't have much marks to play with. So you have whatever you are writing is only giving you out of 5. So you have to think it doesn't have the examiner doesn't have much to play with. How do you think if you don't write ATLS, where I'm going to cut your marks? If you don't write which plate you are using, I don't know where to cut your marks.
Mm.
So if you're
Oh,
mentioning that you are reconstructing or fixing your radial head or replacing it, you have main is that you are doing something for the radial head fracture. Either you are fixing it or replacing it. That is more important. Which plate, which wire, which instrument you are using doesn't matter.
okay, sir.
It's more important to tell the principle. Again, the principles are being checked. LUCL repair plus minus MCL repair. Again, anterior band of MCL plus minus X fix. Okay. And approach, you mentioned the lateral approach and the medial approach.